We're going to have a brief discussion about the coding path. A student said to me earlier this week that she wasn't that sure if she was selecting the correct code. And my response was, if you follow the coding path, then you should be assured you're selecting the correct code. So you may ask, what is the coding path? Well, a coding path is all of the codes related. They can't see my screen?
Yes.
Okay. Well,
Sorry
I just
for interrupting.
Thank you. I appreciate that. All right. Well, a coding path is all of the codes related to your code selection. Well, why do we need to know the coding path of the code selection? Well, it'll verify or confirm you're on the right track, and all of the coding paths, notes, guidelines, and extender boxes are relevant to your code selection. So the student that wanted to know if she was coding correctly, if she understands the path, she'll know it. But also, those notes, guidelines, and extender boxes are very relevant to your code selection. In other words, you have to read it. You do. All right, so let me show you. All right. Let's look up. Well, you don't have to do it. If you want to, you can, but I really want you to look at the screen. Let's look up asthma. And we're in the index. The code that you see next to asthma is what we know as the type it in the chat. Type it in the chat. What is this referred to? Not quite. Some people, yes, 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 it's the default code. Well, this default code is your reference code when determining the coding path. When we obtain this code, this will tell you, I just came up with this and I want to say it with as few words as possible without confusing you. But this code give me a minute, please. Okay, this is how I want to say it. All right, so this J45.909 is our reference code, and this is the path that we have to follow. All categories, subcategories, and codes must fall in the order of the reference code to be considered along the path. All right, so some of you may get it, some of you may not, but you might get it when I show it to you. So let's look at the code closely. J45.909, 6 characters long. J45 is your category, 0.9 subcategory, 0.90 subcategory, 0.909 code. Now, to the left of your screen at the bottom is your reference number, J45.909. This is our code for asthma. All of the codes within this path must fall in the order of the reference code. Now, when I say that, I'm saying J45. J45, J45, that's your boss. This is asthma. You have to read it, and it is relevant to your reference code, the code that you want to get to. So, asthma. The next code in the path is J45.9. J45.9 is other and unspecified asthma. The next, J45.90, unspecified asthma. J45.909 is your code. And if you can just take a moment to just kind of see what happened. Your code at the bottom, J45.909, 6 characters long, all of the codes related to it or on the path, J45, J45.9, 90909, all relate to your reference code, meaning all of the guidelines, notations, and any kind of notation or guideline or extender box assigned to it applies to your reference code. So be mindful when you're coding. You do have to read all of them in the path. Now, we talked about one second. Now, I want to show it to you in a different way, just for some people that are more visual. Okay, so you've got all of the codes along the path of J45.909. Your category is J45. All of this language applies to your reference code, J45.909, so you have to read it. J45.9, other and unspecified asthma. J45.90, unspecified asthma, and the language and the terms underneath applies to your reference code, your J45.909, so you have to read it. And then there's your code, J45.909. So this is how you can determine if you're on the path. Also, if you're looking at the codes, asthma, J45, that's your boss, that's your category. You can't code it because you got a red box next to it. J45.9, got a red box too. You can't code it either. J45.90, can't code that, got a red box next to it, but you sure can code your code. And that's just a way to determine if you're on the right path, if you're coding correctly. And remember, all of the notes, guidelines, and extender boxes along the path are relevant to your code, okay? Now, some people might not get it. They may say, well, why are you saying that, Mrs. J? Why are you telling us about these codes? Because there are codes that are not on the path, okay? These codes are right in between your path codes, and they could throw you off. If you look at mild persistent asthma, it doesn't belong. You don't read it because it's J45.3. 3 is not on the path. Our path is a 9. J45.4, that's not on the path. And J45.5, not on the path. So your code must fall in the order of the reference code. All right, so your characters have to fall in the order of the reference code to be on the path. And that's it. So that's basically a coding path. So I'm not able to see the comments in the chat, but I want you to tell me, what is the coding path for microscopic colitis? And here is the code here. I'm giving it to you. Can you tell me what the coding path is for K52.839? I'll give you a minute to look it up. Okay, some of you got it. Some of you are getting there. All right, so let's take a quick look. K52.838. Remember, all of the characters have to fall in the same order. K52, other and unspecified non-effective gastroenteritis and colitis. K52.8. Let's find K52.8. Other specified non-infective gastroenteritis and colitis. K52.83, microscopic colitis, and K52.839, microscopic colitis, unspecified. And a lot of you did really well. Outstanding. So the moral of the story, know your coding path and make sure that you read all notes and guidelines associated with all of the codes along your reference codes path. Very good, coders, very good. Thank you all so much. All right, so let's talk TAP really quickly. How do you tap your ICD-10-CM manual? 3 steps. Tab the guideline for easy location. Annotate, underline, or box your keyword in the guideline. And 3, place the word TAP next to the code that has a specific guideline next to it. All right, remember our scenario from last week? Peggy has been HIV positive for 5 years. She is now 28 weeks pregnant. She arrived to the ED with labored breathing. After tests, she's diagnosed with AIDS, with pneumocystis carinii pneumonia, code the encounter. Okay, coders, first thing I'm going to do, this is my TAP instruction. So I'm going to go to my guideline. I'm going to find the guideline that relates to pregnancy. I do boxing. That's my thing. So, and next to pregnancy in HIV, I put the sequencing order 098.7 dash, and second B20, third HIV related illness. And I also box the guidelines so I can reference it. All right, so someone asked the question earlier today, how do you know that you sequence HIV before the HIV related illness? It's not actually here. It's a little further up. It says that you code HIV before the related illness. So anytime you have that setting, that's how you sequence it. In this section, it just tells you followed by B20 and HIV illnesses, but the guideline that precedes this tells you that you sequence B20 before HIV related illness. So I'm sorry I got off track a minute, but I wanted to address that too. And I see the person in the audience, so I had to tell you that. All right, so there's my sequencing order. I'm going to my tabular list, and next to it, I have the word TAP, and I also have the sequencing order right here. So if I have to answer this question, I don't have a whole lot of looking up codes to do because I can see that D is sequenced properly. It mirrors my TAP. So D is my correct answer. Now, how was I able to tap my tabular list, my guidelines? Well, I have a TTT manual, and inside the TTT manual, the flip portion right here, this well, the guideline is HIV disease complicating pregnancy, and the sequencing order is in the third column, and I was able to choose D. So that's a brief instruction on TAP. And I think it's time to turn it over to Miss Rochelle.
Yes, Mrs. J, we are going to be doing a challenge. So while I'm transferring the screen, you guys pull out those TDT. You are going to need them. Okay, just give me 1 second. Let's get ready. Pull out. Did I say the right word? Sorry if I didn't. Okay, are we ready? So we're going to do a challenge. So let me start. Your answer choices are A, R65.20, A41.53, and J96.00. For B, you have A41.53, R65.20. C, you have A41.53, R65.20, and J96.00. And D, you have R65.20, J96.00, and A41.53. Ishmael, a 67-year-old male, had been working around the house and all of a sudden became lightheaded and dizzy. After awakening from a short nap, the symptoms were still present, accompanied by nausea and a fever of 102 and increasing. The symptoms prompted the patient to call an ambulance. By the time of arrival up to the hospital, the patient's temperature elevated to 104 and he was severely dehydrated with difficulty breathing. The ED ordered IV pulse oximetry and labs. After the results came back, the ED physician diagnosed the patient with sepsis due to Serratia and respiratory failure. The ED physician admitted the patient into the hospital for an in vivo antibiotic treatment. What is or are the ICD-10-CM codes for this encounter? And I would give you a minute and a half to solve this. And if you can, please give us your keywords as well and put your answers in the chat. And your time starts now. Okay, wow, I'm seeing your answers in the chat, and you are doing great on this one. Okay, I'm just gonna wait just a couple more seconds because I'm still some people putting in their answers. Okay, most of you who have answered actually got this one. And some of you are actually giving us your keywords. That's even better. Thank you, guys. Okay, so we're gonna move on. Let's break this scenario down. Okay, so the answer here is C. And I'm going to go over my keywords first before explaining everything. I got 67-year-old, lightheaded, dizzy, temperature elevated, dehydrated, difficulty breathing, diagnosed with sepsis due to sriracha and a respiratory failure. So, having said that, I'm going to pull out my TTT and use this guideline here for sepsis with acute, organ dysfunction or failure, because see we have an organ failure here. So this is appropriate. So I'm gonna look here, this code language here. It says anytime sepsis is accompanied by an organ dysfunction, the diagnosis becomes severe sepsis. Now that is very important to know because look here, our scenario has an organ failure. So the sepsis here changes, and that says a lot. That will change the whole thing. So we are not going to be just coding for sepsis. We are going to be coding severe sepsis. After that, we're going to go to our sequence. So first, we will need a code for the underlying systemic organ infection, or A49 if it's unspecified. In this case, it was specified. We're going to be looking for the Sriracha. I'm not sure if I pronounced it correctly. If not, I apologize. And then second, we're going to need an R65.2 code for severe sepsis. Now, look here. What does that say? From here, actually, you can eliminate some of the answers. So let me just know. We are not Yes, we are not coding R65.2 first. So that means if you look at the answers here, we can actually eliminate A and eliminate D because they are coding R65.20 first. So we don't have to deal with those anymore. Those are wrong. Okay. So next, we are going to need a third code for the organ dysfunction because we did had an organ dysfunction. Now, if you look here, B, there's only two codes there. Where is that organ failure code? Don't know, and it's not there, so therefore that is wrong. So from there on, you can actually just, you're good, but we are going to be looking for that code to confirm the answers. So let's go. Now, if you go to index, you're going to go for sepsis. And you are going to we are looking for this underlying systemic organism. Okay, so you're going to go down and you will find this gram-negative. Now, if you actually search this sriracha, that is a kind of a gram-negative organism. But just a little clue, it says there an organism, and we do know that there's a specific kind of sepsis that we're dealing this with. So we are going to use that. So after that, following our path, you go to the tabular list. Now, I did not go to the main source and the boss here, but just know that considering that, I'm just going to shortcut here for time reasons. So we are in a subcategory sepsis due to other gram-negative organisms because that's where the code leads us. And if you look down, we are going to find this Sriracha over there. And that's your code A41.53, and that should be listed first. So you're good. So next, okay. So next we are going to be looking for our severe sepsis, right? Okay, so we're here cutting it on your severe sepsis. And if you look down here, you will find it here. severe sepsis, and without septic shock. We just had a basic severe sepsis. Now, look at these codes here. This is very important, so you read through them. It says here, first code, underlying infection. That's what our TTT manual tells you, and that is what the guideline is saying. So we follow that, and we got that A41.53, remember? And then if you look farther down, it says here, use an additional code to identify specific accurate organ dysfunction. And if you even look a little more down, you will actually find an acute respiratory failure there. That would lead you to J96. So that would cut so much time. You don't even have to go there because that is given, but for the purpose of showing you, so we are gonna be leaded to that respiratory failure right here. And if you go down, you will find J96, your acute respiratory failure specified. So now this whole codes, all three of them is telling the whole story of what your scenario is about. Okay, so let me just take a peek if you have questions. And if you don't, please say you got it. Okay, I'm saying got it, got it. Okay, awesome. Okay, so I have another one.